Imagine the most precious moments of your life, being with family, laughing with friends, petting your favorite pet, or just feeling the peace of nature. Can you feel the connection, the happiness? Now imagine that those memories start to fade or become so distant that you no longer know if they are real or just dreams that are fading away. This is the reality for more than 55 million people around the world who suffer from dementia, and each year more than 10 million new cases are reported. Dementia is one of the most deadly and disabling diseases in the world, and science has recently revealed that this problem begins to affect the brain decades before the first symptoms appear. But the good news is that in many cases, it is possible to prevent this from happening or delay its progression by changing our habits and diet. Want to understand how? Let's go on this journey together to discover the warning signs, how to detect them early, and most importantly, what ingredients and habits can help preserve your mind and health. Prepared? Dementia is a complex condition that goes far beyond the common forgetfulness we all experience from time to time. It profoundly affects the ability to remember, think, and make decisions, interfering in daily life in a significant way and often impacting not only the individual but everyone around them. And although anyone can have occasional memory lapses, such as forgetting a key or someone's name, this does not characterize dementia. The diagnosis is only made when memory, language, and reasoning failures become constant and intense, affecting the person's independence and well-being. To better understand, it is important to differentiate dementia and Alzheimer's. While the term dementia encompasses several conditions that affect cognitive functions, Alzheimer's is the most common form, responsible for a large proportion of cases. But what causes Alzheimer's? Inside the brain, neurons communicate through synapses, where they exchange chemical messengers that enable our ability to think, feel, and remember. During this exchange, a substance called beta amyloid is released, but it is usually eliminated by specialized cells. However, when this process fails, beta amyloid accumulates, forming plaques that begin a cycle of inflammation and damage in the brain. This accumulation of plaque begins decades before symptoms appear, showing the importance of taking care of brain health as soon as possible. The risk factors for developing dementia are varied, and the main one is age. The risk increases significantly after age 65, but is not exclusive to the elderly. Having close family members with dementia, such as parents or siblings, increases the risk, as do health conditions such as poorly controlled hypertension and diabetes, excessive use of ultra-processed foods, and excessive sugar consumption. Studies indicate that loneliness is also a relevant factor, while social connections and frequent interactions with other people have a protective role against dementia. In addition, severe head injuries, smoking, and high cholesterol also increase the risk, making it even more crucial to adopt a healthy lifestyle at all stages of life. The first symptoms of dementia can be noticed subtly, often by family and friends themselves. Among the most common early signs is loss of recent memory, while older memories remain intact. For example, the individual may forget something they did or heard minutes before while remembering distant events. In addition, there is a loss of interest in previously pleasurable activities, personality changes, paranoid thoughts, such as believing that someone is stealing or harming, and changes in the way one walks. Over time, the situation can worsen to loss of judgment, aggressive behavior, hallucinations, and, in more advanced stages, the person stops considering family and objects, becoming dependent on basic activities. However, it is important to highlight that not all symptoms of dementia are permanent or irreversible. In some cases, they may be the result of other treatable conditions, such as vitamin B12 deficiency, thyroid problems, brain infections, or even the side effects of medications. Even stressful stress and severe depression can cause dementia-like symptoms, reinforcing the importance of a complete assessment for an accurate and individualized diagnosis. Nutrition is fundamental to brain health and can be a powerful tool in preventing dementia. A diet rich in green leafy vegetables, red fruits, pomegranates, avocados, and foods rich in omega-3, such as fish and nuts, protects the brain and reduces inflammation, combating damage caused by free radicals. These foods contain essential nutrients that promote neuroprotection, and their daily inclusion in the diet can delay brain aging and reduce the risk of dementia. In addition to nutrition, staying physically and mentally active is crucial for brain health. Endurance exercises strengthen not only the muscles but also the brain, while intellectual activities such as games, reading, and puzzles keep the mind functioning and help delay the onset of symptoms. Sleep is also essential, as sleep contributes to memory consolidation and brain regeneration. Another recommendation is to maintain an active social network, as loneliness is a significant risk factor for dementia. Regarding supplements and vitamins, such as vitamins B12 and D, they may be recommended in specific cases, such as in people with a proven deficiency. Vitamin B12 is particularly important for vegans and those with conditions that make it difficult to take it, while vitamin D is essential for general health, and its deficiency may be linked to an increased risk of dementia. However, ginkgo biloba, although highly recommended, still does not have scientific proof of a positive impact on memory and attention. Finally, the topic of dementia and Alzheimer's leads us to understand that we are facing a complex challenge, which involves an interaction of several biological, genetic, environmental, and lifestyle factors. Dementia, in its many forms, is not just a medical condition, but a manifestation that profoundly impacts the lives of individuals, families, and communities. It is a disease that affects not only the ability to record, reason, and make decisions, but also the identity and social interaction of patients, which makes its impact even greater. Recent studies have revealed that, although there is no cure, it is possible to modify several risk factors. Evidence suggests that lifestyle interventions such as a balanced diet, regular exercise, cognitive stimulation, and adequate sleep can not only delay the onset of dementia, but also slow the rate at which the disease progresses. This brings a hopeful perspective that through conscious choices, it is possible to promote brain health and delay, or even prevent, the onset of dementia symptoms. However, this care must begin long before the first signs, as financial changes can begin to occur decades before symptoms manifest. Advances in technology and medical research have significantly expanded our ability for early diagnosis. Advanced imaging and biomarkers are making it possible to detect specific Alzheimer's-related changes in early projects before cognitive impairment becomes evident. This opens up the possibility of preventive interventions and new treatments that, although still in the development phase, bring new hope for slowing or even reversing degenerative processes. Still, Alzheimer's and other forms of dementia continue to demand global attention. The aging of the population causes the number of cases to increase exponentially, challenging health systems and generating the need for new public policies. The demand for trained caregivers and the creation of inclusive environments for people with dementia are crucial points to be considered. Furthermore, it is essential that society develops a deeper and more empathetic understanding of dementia, breaking stigmas and valuing patients' preserved capabilities. Furthermore, emotional and psychological support for families and caregivers is essential, as the emotional and physical burden of caring for a person with dementia can be immense. Projects that promote support networks and provide guidance on disease management are essential to improve the quality of life of both patients and caregivers. The fight against dementia is not restricted to the development of drug treatments, but also involves changing habits, inclusive policies, and social support. We need to think about integrated and preventative health strategies that recognize the complexity of the human brain and the importance of mental health. Although the road is still long, each advance brings us closer to a more informed, qualified, and supportive society where dementia patients can live with dignity and find support at every stage of their journey.